Namaste everyone. Respected chair, fellow presenters and distinguished participants. It's a privilege to be here today to share my presentation on suicide prevalence in Nepal, evidence from the 2021 census. As you can see from the image in the background, you can easily guess that hanging is the most common form of suicide in Nepal. So I have structured my presentation on mainly 4 parts: introduction, methodology, findings, and the conclusion. Before moving on to the next slide, I would like to share a kind of like thought-provoking line that is, suicide is the last resort people take to get rid of the mental stress. And I want to repeat it on my own version in Nepali, like मृत्युसँग डर नमान्ने मान्छे प्राय को होला र मान्छे सकेसम्म आफ्नो मृत्युलाई धकेल्न चाहन्छ तर मानसिक समस्याबाट गुज्रिरहेका मान्छेहरू चाहिँ त्यो समस्याबाट पार पाउने अन्तिम प्रयासका रूपमा चाहिँ मान्छेहरूले आत्महत्या वा त्यसको प्रयास गरिरहेका हुन्छन् हैन त्यो मनको उपचार सम्भव छ that's why we are saying suicide is public health problem which is preventable. Now let's move on to the intersection. I would like to start from the global context. More than 726,000 deaths in a year and many more to attempt, and alarmingly second leading cause of death among adolescents and third leading cause of death among the youths of age 15 to 24, and sadly 12 leading cause of death globally among all age groups. Now move on to the national context. According to Mental Health Survey 2020 conducted by NHRC, suicidality among adults was found to be 7.2%. Currently, suicidal thought equal to 6.5, and lifetime attempt was around 1%. In case of adolescents, suicidality and current suicidal thought found to be equal, almost same at 4%, and lifetime attempt was less than 1%. On the other hand, if you look at the Nepal police data, the suicidal death has been steadily increasing from the last decade with an over annual growth rate of 5%. And suicide is rarely caused by a single circumstance, it is multifaceted. And the key contributing factors that can be categorized into socio-cultural, psychological, economic, and political factors. The burden of suicide viewed on different lanes in developed and developing countries. While the Western countries have realized the burden of suicide and are prioritizing mental health for prevention, the developing countries are still struggling with social factors influencing suicidal ideation. Now, suicide is considered as a kind of like hidden epidemic. So, objective of this study is to look at the prevalence of this silent epidemic into different ecological belt, administrative level, demographics, and also look at the some factors that are associated with it. Now let's come to the methodology section. I have used data from Census 2021, and the suicide rate is calculated on 100 per thousand population, and descriptive analysis was carried out to look at the prevalence of this epidemic, and also we have performed inferential statistics to look at the factors that are associated with the suicidal rate. Now let's look at the finding from the national context. If you look at the map, 18 deaths per lakh population, and it translates to 14 per day. तर यो चाहिँ नेपाल पुलिसको डेटा अनुसार चाहिँ 20 जना मान्छेले चाहिँ प्रतिदिन आत्महत्याबाट आफ्नो देहत्याग गरिरहेको कुरा चाहिँ हामी पाउँछौं. So if you look at the ecological belt, mountain has the highest compared to hill and tarai, and same case in rural as compared to urban. If you look at the provincial level, Kosi and Gandaki have the highest, and Madhes have the least, and male are more committed to suicide than female. If you break it down into provincial level, more proportion of male from Kosi and female from Sudar Paschim province died by suicide. If you look at like district variations, white color represents the zero death and blue color represents highest. The Solukhumbu has the highest death rate and Humla was the only district with no recorded case. If we look at the local level variations, the suicidal death is widespread across Nepal but concentrated on hill and mountain region of Kosi, Bagmati and Gandaki provinces. If you look at the corner, the bar graph shows that top 10 local levels. Among top 10, 2 from Solukhumbu, 2 from Manang and Malika rural municipality from Magdi district has the highest prevalence. Now let's come to the negative binomial with age-specific death rate. If you look at the bar graph, red standing color on middle of the bar shows that youth are the most vulnerable group. So यो केसमा चाहिँ हाम्रो 20 देखि 19 वर्षका उमेर समूहका युथ्सहरू who are in the transition phase of their life from युवा अवस्थाबाट चाहिँ यो अवस्थामा चाहिँ सबै किसिमको प्रेसरहरू just like example like education, family, economic independence का कुराहरू आउँदाखेरि चाहिँ यो उमेर समूहमा अलिकति बढी देखिन्छ। अझ 50 देखि 59 उमेर समूहमा पनि incident चाहिँ बढी नै देखिन्छ। We have also performed negative binomial distribution to look at the some factors associated with death rates. As we have more than 6 lakh population living in some kind of like disability, and migration is the also common phenomenon in the last two decades or so, as more than 2 million population living outside their home. So we use this absentee population and the population with disabilities in this model with others. High proportion of disabled population is highly positive correlated with suicidal death, and also absentee population is also positively correlated, but better access to public health and higher proportion of poorest population, these two variables are negatively associated with suicidal death. Kosi and Bagmati province has positively significant association, while Madhes has negatively correlate, and also the risk of natural disaster is positively correlated with suicidal death. And recommendation part, suicide is widespread in Nepal with higher risk among youths, people with disabilities, men, families left behind, region specific, and due to social stigma, need to advocacy for mental health through active engagement of different sectors, including media, need for rationalization as it remains is significant public health concern in Nepal, ranking among leading cause of unnatural death, focus on identification and preventive approach by strengthening mental health research, and incorporate this into educational institution as well as work station. Do you have any suicidal thought? You are not alone. Please call at 1166. You are not alone. It's available 24/7. Thank you.